My dear students, Dr. Ashfaq over here, and as you are well aware, I have authored books for NEET PG, NEET DM, NEET MCH, as well as some of the books for USMLE examinations, MRCP examinations, and my lectures would be intended to get you right on the top there for your next examinations, DM examinations, MCH examinations, MRCS, MRCP, USMLE examinations. I hope my videos will benefit you a lot. I will be presenting my things in a very easy, simple and palatable form for you. Wish you good luck for your exams. Thanks a lot. My dear students, today I would be focusing through one of the most important topics which is asked from a medical viewpoint, from a physiological viewpoint, and my today's focus would be a topic, Myasthenia Gravis. As far as Myasthenia Gravis is concerned, we have to go back to a bit of physiology about this disease, the pathophysiology of this disease, and then the clinical aspects and the treatment modalities of this disease. So as far as Myasthenia Gravis is concerned, you are already well aware that it is a disease of the neuromuscular junction, and at the neuromuscular junction we have got those acetylcholine receptors. In this disease, basically there is characteristic affection of the skeletal muscles. The patients present usually with weakness and fatigue of skeletal muscles. And what is important about the pathophysiology is that there are those antibodies, to be more specific, autoantibodies directed against acetylcholine receptors at the neuromuscular junction. So we have got those acetylcholine receptors at the neuromuscular junction, and there is this important development of antibodies at the neuromuscular junction. Now, what are the very important groups of muscles which are basically affected in Myasthenia Gravis? The most important group of muscles are the eyelid muscles, which will come into clinical manifestations first of all. So the eyelid muscles and the extraocular muscles will be affected predominantly. There might be facial muscles which would be affected as well, in addition to the muscles of the limbs which would be affected. Now we classically start this disease with the weakness of the extraocular muscles and the patient presents with a bit of ptosis. In addition, there might be facial weakness going ahead. In later stages of the disease, there will be presence of aspiration pneumonitis or aspiration pneumonia in case the Myasthenia Gravis has spread to the bulbar group of muscles in case of bulbar palsy. In addition, there might be late stages manifested with respiratory failure because the chest wall muscles, the abdominal and the thoracic muscles may get weakened to such an extent. So you can have a range of symptomatology depending upon the muscle groups involved, and you have to remember eyelid muscles, extraocular muscles, facial muscles, the muscles of the upper limb and the lower limb at later stages, and there can be aspiration pneumonia and respiratory failure. So these are some of the important clinical manifestations. Now, you have to remember that classically this disease can be tested by simple mechanisms. For example, you ask a patient to comb. With repetitive combing, there will be more of weakness and fatigability, and at a later stage a patient will not be able to comb his or her hair. So that is a simple test, because with repetitive and sustained muscle contraction there will be decreased acetylcholine release at the neuromuscular junction. So very important, repetitive stimulation and repetitive contraction of these skeletal muscles will cause correspondingly decrease in acetylcholine release, causing weakness and fatigability as we go on progressing with more muscular activity. Very important fact. Now, this disease has got a feature that it is classically associated with other autoimmune diseases. We know a whole range of these diseases like systemic lupus erythematosus, Hashimoto's thyroiditis, Graves' disease, Addison's disease, and this disease can occur simultaneous to these diseases. In addition, a very characteristic feature asked about Myasthenia Gravis is the presence of thymic hyperplasia. Hyperplasia, not hypoplasia. and the presence of thymoma in 10 to 20% of the patients with myasthenia gravis. And how do we diagnose this disease? The presence of acetylcholine receptor antibodies is highly specific for this disease, as well as there are muscle specific kinase antibodies in 40 to 50% of patients with this disease. Then we have got this very frequently asked Adrophonium test and the tensilon test. It is seen that anti-choline esterase agents improve muscular activity. This Adrophonium is a short and rapid acting anti-choline esterase agent, and with the application we can have much improved muscle strength. There's a simple test which we give the name as Adrophonium or tensilon test. Then we also have decrease in amplitude of evoked motor responses on EMG. That's very characteristic feature of myasthenia gravis. And CT and MRI would just pick up a thymoma in case it exists with this disease. Very careful about myasthenia gravis is that you have to avoid certain group of drugs while the patients are having this disease, because that can lead to abrupt muscular paralysis or failure. And the groups of drugs which you have to avoid are: number one, the aminoglycoside group of drugs, gentamicin, streptomycin, kanamycin, neomycin. You have to avoid in patients with myasthenia gravis. Then the quinolone group of drugs, ciprofloxacin, sparfloxacin, norfloxacin, levofloxacin, pefloxacin, the whole range of drugs which come along with this group of drugs, they are to be essentially avoided in patients with myasthenia gravis. Then the macrolide group of antibiotics, the erythromycin and the azithromycin, they are also to be avoided. In addition, you have to remember the beta blockers, so many of them: propranolol, timolol, nadolol, metoxolol. So you have to avoid beta blockers in patients with myasthenia gravis. Then the quinine and the quinine derivatives, you already know they should be avoided in patients with myasthenia gravis. Then there is this important penicillinamine. I am not talking about penicillin. Penicillinamine, a copper chelator, that is to be avoided in patients with myasthenia gravis. Local anesthetics like procainamide, prilocaine, they are also to be avoided in patients with myasthenia gravis. So these are very important drugs which are to be avoided in patients: aminoglycosides, quinolones, macrolides, beta blockers, quinine and quinine derivatives, and the chelators like penicillinamine. Now, what are the drugs used in treatment of myasthenia gravis? You have to remember this important drug, pyridostigmine. It is given as a prime modality of treatment in treatment of myasthenia gravis. We have also got plasmapheresis being done in certain group of patients, and they rapidly respond to plasmapheresis. Intravenous globulins, they are used routinely in treatment of myasthenia gravis. Then sometimes the patients benefit a lot from thymectomy, because thymomas or thymic hyperplasia are associated with many patients, and the autoimmune basis tends to be from there. So thymectomy can also help in improving the symptomatology of myasthenia gravis. Corticosteroids are widely used in widespread disease, and we can give them in intravenous form. Then we have got this group of immunosuppressants which are also very helpful in myasthenia gravis, and among them azathioprine, cyclosporin, tacrolimus, cyclophosphamide. We are well aware of these drugs, and they are very beneficial in the treatment of myasthenia gravis. So to round up myasthenia gravis associated weakness and fatigue of skeletal muscles characterized by autoantibodies against acetylcholine receptors at neuromuscular junction, the groups of muscles involved, the ocular muscles, extraocular muscles, eyelid muscles, facial muscles, limbs, then the diagnostic facilities which I have told you help in aiding, then the drugs to be avoided, and the drugs used for treatment. That's all about myasthenia gravis, and I hope that you would be just benefited a lot from this condensed briefing of mine. Wish you good luck for your exams. Thanks a lot.